Welcome, everyone, to our Strong Start and Beyond webinar. My name is Dr. Diana Ramos, and I am the California Surgeon General. And it gives me great pleasure to invite us all to learn more about fitness and nutrition for optimal health. We have some amazing speakers that are going to share some tips, some information from childhood all the way to adulthood and beyond just the fitness and nutrition, but the mind, body, and soul. So it's going to be a great webinar. Can I get the next slide, please? As a reminder, this is what I can do, what my office can do as Surgeon General for California. And the big takeaway is be the leading spokesperson on the most pressing public health issues in California, as well as to convene and communicate partners and the public on these. So thank you. Next slide. For logistics, everyone is muted on entry. Please use the Q&A function. And I want to say at this point, it's the chat team. We have the Q&A function. To ask your questions, we're going to try to answer the questions as the webinar is ongoing, but there will be opportunity at the end for those of you who want to articulate your questions to do so. We welcome your feedback. Our email is there. Please, we are the voice of California, and we want to hear from you. We want to know how we can do things better. And the session is being recorded and will be available on our YouTube channel. Next slide. We're going to be moving on from, after my brief slides and overview, to hearing from WIC, the Women and Infant Children's Program here in California, as well as the LA84 Foundation, an amazing organization that really focuses on our kids, our community, provides opportunity for our kids to get healthy and exercise, as well as the American College of Lifestyle Medicine. So this is the specialty that really brings in the mind, body, soul, emotion of health. And it really is a wonderful opportunity for us to learn more, especially if there are any providers, what we can do to care for our patients better. Next slide. The big takeaway that we want is come away with knowing how can we improve our fitness and nutrition, because it is Fitness and Nutrition Awareness Month. Next slide. Starting with a reminder of our Strong Start and Beyond, our movement to reduce maternal mortality 50% by December 2026, as well as to educate and empower individuals on their reproductive health. The one thing that we have to be aware of is that cardiovascular disease is the most common cause of pregnancy-associated deaths in California for all ethnicities. And the reason why that's important to remember is the fact that oftentimes it's the obesity, lack of exercise, healthy habits that we can all do can help prevent the risk factors for cardiovascular disease. So that's why today's webinar is so critically important, because it's really going to give us some concrete, doable actions to improve our health and nutrition and decrease our risk for cardiovascular risk. Next slide. So the health of the mom influences the health of the family. And this is so true when we are talking about nutrition, because it is the mom. Typically, yes, the dads do as well, but typically the mom is the one that decides what is going to be prepared in the household, as well as not only what foods, but what time people are going to be eating. And can we make cooking part of a family affair? And here you see that picture. And also when children see a mom exercising, walking, it's part of a healthy habit. Moms are oftentimes, as well as dads, but oftentimes if children are spending more time at home and the mom is the primary caregiver at home, then there's that modeling that we see. So we want to make sure that we model healthy eating, healthy movement for our kids. And that's not always possible, but our hope is that if kids start to see it in the community, it's going to be something that we're going to do more readily. Next slide. I want to highlight the Governor's Advisory Council on Physical Fitness and Mental Well-Being. The first partner, Jennifer Siebel-Newsome, as well as Lonnie Lott, are both of the chairs for this council. And the council's mission is to promote equitable and sustainable access to physical fitness and mental well-being resources for all Californians, prioritizing youth and families. So it's so wonderful to have programs such as this in California as part of leadership from the top, recognizing the importance of physical fitness and mental well-being. And Renata Simril, who is one of our speakers today on LA84, is on this council. So happy to have her share some of the things that her organization is doing, and you'll hear from her later on. Next slide. The reality is, again, going back to the fact that nutrition is really critical and core to our health. Food is medicine, but the reality is that about 19% of pregnant people have some food insecurity. So almost 1 in 5. 42% participate in WIC during pregnancy. This is California specific. And about 19% receive CalFresh during pregnancy. Again, trying to ensure that the nutrition availability is there during pregnancy, especially because we're seeing food insecurity in about 1 in 5 people. Next slide. And in terms of physical inactivity, this is from America's Health Rankings. And in California, we are smack in the middle. We rank 25 out of 50 in terms of our inactivity. So we need to move more. Again, if we move more, something as simple as walking, something as simple as dancing in our living room, that's my favorite. Our kids are going to see that, and the hope is that they're going to model that, and it's just going to be normal to walk and dance. Next slide. So we want to get started now and listen to some of our experts. Fariha Chowdhury serves as the California Women, Infants, and Children Division Director at the California Department of Public Health. And in her current role, Fariha is committed to promoting innovation and improving access to WIC services. Fariha, the floor is yours. Take it away.
Thank you, Dr. Ramos. It's truly a pleasure to be here with you, Renata and Dr. Rea, for this webinar. I've been following your office's outstanding work on ACEs and toxic stress and maternal health. And what's particularly great about the conversations that your teams hold is the focus on how advancing systemic reforms entails that organizations like WIC, like LA84, and like the American College of Lifestyle Medicine, that we all collaborate in strengthening support for those who need it the most. So thank you. All right. So I think we're ready to go on to the next slide. And that's me. And then we can move on to the next slide after that. All right. So I am here to talk to you about how WIC helps California families get a healthy start. Becoming a parent and navigating the early years of a child's life can be incredibly fulfilling and magical, and also quite challenging. And WIC is here to offer support every step of the way. Whether you or someone in your household is expecting, caring for a baby, or raising young children. And California WIC is the largest WIC program in the nation. We help participants get access to healthy foods, expert nutrition education, and infant feeding support, and referrals to healthcare and community resources. Now, on the next slide, we'll see more about the first way that WIC helps. So the first way that WIC helps your family's fitness and nutrition is that it provides benefits for a variety of healthy foods. Eating well, as Dr. Ramos said, can make a big difference for your family's health. With WIC, you will receive benefits to help you buy a variety of foods, which include fresh fruits and vegetables, whole grains and cereal, milk, soy milk, eggs and cheese, tofu, baby food, infant formula, juice, peanut butter, and more. WIC participants receive a monthly benefit from our science-based food packages that support growth and development. Our food packages are prescribed to accommodate personal preferences and also the dietary and nutritional needs of each person. On the next slide, for those who are familiar with WIC, we made the switch from checks to a card in 2020. It's made shopping much easier and faster, so that means that you can use one card for all of your family's food benefits. You can shop for all your foods at once or just a few at a time. And unlike with our checks, you do not have to worry about losing those benefits if your WIC card is lost or damaged. And then on the next slide, we can talk about the app. So WIC families also use a free California WIC app that provides an easy way to access your WIC information from a smartphone. The app includes a search feature to locate WIC offices, grocers, your next appointment, and also your family's WIC food benefits. It also includes a barcode scanner to help locate the foods you can purchase with WIC, and also a WIC shopping guide. And pro tip for non-WIC participants, you can essentially use that barcode scanner to find the healthiest food items on shelves. And then the second way, on the next slide, the second way that WIC helps your family's fitness and nutrition is our individual and group nutrition classes, with many locations offering video appointments and classes online that once again are tailored to your needs and are on topics such as healthy eating, active living, starting your baby on solid foods, and tips to get your toddlers to try new foods. Sometimes I need those tips as well. And then on the next slide, one of the greatest things about WIC is getting access to registered dietitians and WIC nutrition experts at no cost. These are folks who can talk to families about even more topics as shown on the slide, and they include healthy foods during and after pregnancy, advice on newborn sleep, crying and feeding cues, healthy child development information, meals and snack ideas for toddlers and children, tips for adding more fruits and veggies to your meals, and meal planning on a budget. This is just one way that WIC helps people make simple, affordable choices that work for their family's needs. Now, on the next slide, I want to talk a little bit more about our nutrition education and health advice. So this also includes supporting families who want to breastfeed or chest feed. Now, breast milk is one of the best things for babies to grow and develop. It's rich in vitamins, minerals, and nutrients, has a variety of health benefits, and helps bond with your baby. Families can learn more at WIC about breast milk, have their questions answered, and get support in person, by phone, and virtually. This support is also personalized and tailored to your goals and schedule, not anyone else's. People who breastfeed or chest feed, they get extra WIC foods and may receive benefits until baby's first birthday. And I do want to note that WIC is also here to support everyone's personal feeding goals. That means that if you choose to feed your baby formula, WIC can show you how to safely prepare and feed your baby formula as well. And then on the next slide is the third way that WIC helps your family's fitness and nutrition, which is that we provide referrals to other programs and services such as CalFresh and local food banks, immunizations, healthcare, community clinics, preschool, treatment programs for drug, alcohol, or tobacco use, and family violence prevention. Now, referrals improve overall health and well-being by connecting folks to the medical care, social services, and support systems that can address underlying issues impacting their nutrition. Some outcomes of referrals include early intervention for chronic disease, and also addressing social determinants of health like housing instability. All right, so let's find out who is eligible for WIC on the next slide. Now, WIC serves people who are pregnant, who have recently been pregnant, and infants and children up to their 5th birthday. Their caregivers would be applying on their behalf. When it comes to additional requirements for WIC services, you can see that on the next slide. Yep, to receive WIC services, you also must have low to medium income or receive Medi-Cal, CalWORKS, or CalFresh benefits. And also to receive WIC services in California, you must live in the state. And then one thing that it's always good to remind on the next slide is that moms, dads, grandparents, foster parents, guardians, and other caregivers may apply for children they are raising. And many working families, including military families, farm workers, and families with private insurance, are often surprised to learn that they qualify for WIC. And then on the next slide, just want to let you know that WIC has offices located throughout California, across the United States, and military bases worldwide. If you are considering applying for WIC in California, I suggest starting with the eligibility assessment that's available on WIC's My Family website. You can also locate a nearby WIC office on that same website, and you can call the number displayed on the screen in helping find a WIC office. Some WIC local agencies do also provide an online form to schedule your initial appointment, and then you see that cute QR code with the dinosaur shown on the screen. That can also help you begin your WIC journey. So for my last slide, I wanted to reaffirm that WIC staff are always here to support families and answer their questions about nutrition, about fitness, feeding little ones, and finding resources in our communities. You'd be surprised by the reach of this program. My predecessor in my current role was a WIC participant. Our current California Health and Human Services Secretary was a WIC mom. My dentist was a WIC dad. We have former WIC participants at colleagues at the state and local agencies. It is a program that's touched countless lives over the last 51 years, and it has done so much to make Californians healthier. Participants and WIC staff often share similar experiences and challenges, which foster a sense of connection and belonging within the program. So in addition to playing a foundational role in improving health outcomes, it also cultivates relationships and safe and welcoming environments throughout California. So I wanted to end my remarks with a testimonial shared by one of our WIC moms. She said, "WIC has done more for me in the first 5 years of my parenting journey than I could ever express. From helping me breastfeed, to wiping my tears during my miscarriage, to filling my cupboards with food during the rough times, the women who work for WIC became my moms when my mom moved away. Thank you, WIC, for setting me up for success as a mom. It takes a village to raise a mother."
So thank you so much for giving us an update and making us aware that WIC really is updated and virtual. I love that resource and the way to deliver services virtually. This is great. Thank you for that. All right, next slide, please. Next, we're going to be moving to Renata Simril. Renata Simril serves as the president and CEO of the LA84 Foundation, particularly those who have the least access to sport, play, and movement. Renata, welcome. Thank you so much for being here.
Thank you, Dr. Ramos. It's a pleasure to be with you. I appreciate the opportunity to share with you our work.
Yes. Now, I know we're going to be having a conversation, so just to make folks aware, we're going to be talking about exercise. So tell me a little bit about LA84's mission and how that interplays with the Life Ready Through Sports program that you're leading.
Yeah, certainly. So the LA84 Foundation is a legacy of the 1984 Summer Olympic Games, and we are a private foundation and manage a small endowment as a result of a surplus that was left in those games. And our work has really been about, to your point, helping to make kids life ready through sports. So we're not about building Olympic athletes or professional athletes or even collegiate athletes, but really using sport as a pathway to build connections, to build community, and to help young people build pathways to lifelong well-being. And we've been doing that for 40 years. About 7 years ago, to deepen our impact, we created a charitable arm to the foundation called the Play Equity Fund. And the Play Equity Fund focuses on 3 key areas. One is raising awareness about the importance of sport play and movement in building healthy lives and creating pathways for young people and their families and communities, quite frankly. We also we organize and build coalitions to advocate for policy changes. We'll talk probably a little bit about the recess bill in the state of California. And then we fundraise and serve as an intermediary to bring much needed resources to communities on the margin who have the least access to parks, to play spaces, to organizations at a free or low cost, so that they can engage in this healthy activity. And we like to say that we're philanthropy on the move with our 1-2 approach to the way in which we've spread more sport play and movement, particularly to marginalized communities.
Thank you for providing the ability to play, the ability to have access to sports. You know, growing up, I was never involved in sports. And I didn't realize the value that sports brings beyond just the exercise. My son is an avid soccer player, and I realized it wasn't just the exercise that he was getting, but it was the mental fitness. It was the positive, the endorphins, the social connections, and how that actually helped with developing leadership skills and get some of that energy out. So tell me more about the programs that you're developing. I had the chance to meet some of your grant recipients, and I came away so impressed about the work they're doing. This is awesome.
Yes. No, thank you. Dr. Ramos, when I took over the foundation, when I became the CEO of the foundation about 10 years ago, we were doing great work. The number of organizations we support, the young people that we've supported through programs over a 30-year period of time up until that point. But what I found really disturbing was that the data painted a different picture. That kids I'm in Los Angeles, but kids in the LA Unified School District, nearly 50% of them are obese and at risk of type 2 diabetes. Black and brown kids are 2 to 3 times more likely to experience stress, anxiety, and depression. Trauma that young people are talking. I know you're a big advocate for adverse childhood experiences, the lack of play spaces, households under $25,000 a year, those kids are least likely to play. And good luck if you have, more than one kid in a family. All while we looked at data that says PE is an unfunded mandate in the state of California, and most kids participate in PE one day, or schools provide it 1 to 2 days a week. So we were the recess until just recently, wasn't a mandate in school, and it could be taken away as recess. And so it was very disturbing to me that you had this juxtaposition of lack of access in these health indicators and this connection between it's the deeply interconnectedness between sport, play, and movement, and physical health and mental well-being, and this sense of community and belonging and building pathways to lifelong well-being. And I'm sure that the audience here are mental health professionals or in the Department of Health. The cortisol levels, that stress hormone when you're engaging activities, the boost of endorphins that you get, the natural mood that's changed, when your heart rate elevates to a certain percentage, that's actually your brain is functioning different. I find that when I work out, I eat healthier. There's issues in our communities about food deserts, and, we work with partners that are looking to address that. The social benefits, teamwork, cooperation, communication skills, respect and discipline, learning to win with grace and weather defeat. Sport and play and movement is such a foundational element to whole child development and health and wellness. That's the work that we've been doing under my leadership for the last 10 years, is really raising awareness through both organizations, funding the sector to, as I said, free and low cost. And then, just really working with partners like the governor's wife, Jennifer Siebel Newsom, and Ronnie Lott on what can we do to level the playing field to ensure that all kids, but especially kids on the margin, who are left out of the game in many ways, that they also have access to sport, play, and movement. And, the last thing I'll say is, with these major sporting events coming to Los Angeles in the United States, the World Cup, the Olympics in 2028, is that we found, a great vehicle and attention on the work that we're doing, and, really moving legislative needles in these coalitions that we've built in Southern California and Northern California, Seattle, Portland, Chicago, all over the US. We have like 13 coalitions that represent, nearly 550 grassroots sport-based youth development organizations that are really doing similar work to ensure that all kids have access to this transformational benefit that we know works to keep them physically healthy, mentally strong, and helping them build pathways to lifelong well-being and success.
That's beautiful. You truly are caring for not just the physical, but like you said, that lifelong success. And with play equity as the baseline for your work, I don't know if you could explain a little bit more, because I had the honor of seeing your film, which was amazing, and we all learn in different ways. And I just wanted to highlight the wonderful film where it really is taking the story of somebody that received one of your grants and made a difference in her community and beyond.
Yeah, it's that's part of our campaign around building awareness. Both our social media, Instagram and Facebook, we've been really active about sharing and telling a story, not just about the foundation and the work through the Play Equity Fund. And again, we are truly, an interlocking organization. So while the foundation is providing funding, doing research, convening, hosting events, the Play Equity Fund is raising awareness, building these coalitions that I've talked about, advocating for policy and legislative changes like the recess bill. We're working currently with Assembly Member Tina McKinnon that just dropped AB 749. That's a study bill to actually look at creating a youth sports ministry, youth sports department within the state of California, because it's an unregulated, industry. And I'll get to the documentary in a minute, but, coaching education, there's no standards or no competencies in terms of, what makes a well-trained coach? Is that coach trained in adverse childhood experiences? Is that coach trained in trauma to meet the young person where they are? Do they know the appropriate connection between brain science and sport, play, and movement to bring out the best in the athlete? Safety for young people. And so, we've been able to, through our charitable arm, raise awareness and drive legislation and bring, this network of, the Coalition of the Willing. And the documentary film was an opportunity during our 40th anniversary to tell the story from a grantee's perspective. A young boxing coach, Daisy Garcia, she's admittedly a two-time college dropout. And it was through connecting through a USC boxing program, Fight On, that she saw collegiate boxing as a pathway to finish college, but also she's now in law school. I think she's in her third year studying law. And she started a boxing program coming out of COVID. And it was a program that we had called Champion Shine here for the college football playoffs, wanted to leave a legacy of how our teachers, coaches, organizations, educators, how are they using sport, play, and movement to anchor social emotional well-being of young people coming out of COVID. I have a 17-year-old who was in middle school during COVID, and we had all of the things, psychiatrists, psychologists, depression, anxiety, and she created this amazing program helping 30, it started about 30 middle school kids, 13 and 14. kids that admittedly had anger issues that therapists couldn't help, young girls whose body image and identity was causing them to think about their value and their worth. And through this boxing club, she's brought out this hope and inspiration in these kids in Lincoln Heights, that they now at the end of the film are talking about their pathway to college and what they want to be when they grow up, which is our way of showing the interconnectedness of sport plan movement to health and wellness, social emotional well-being. But it's also an effort for the world, quite frankly, to start to shift their thinking and their mindset about sport plan movement. So if the LA84 Foundation or an organization says, I want funding or a partnership and I'm in a sports organization, is not for people to think about competitive sports or professional sports, but for the public to think about sports, play, and movement as an entry point to educate and to support whole child development, as I said, strong physical and mental well-being, pathways to college and to success in life. And that's what the documentary film really, hits on. The last thing that I'll say, Dr. Ramos, is that oftentimes this film is really important because oftentimes when we think about or talk about marginalized communities, Black and Brown communities, is that we see deficit in our young people, that the challenges that they're facing in this world are their own problems, the trauma that they're feeling, the anger that they're feeling. I'm thinking of one young man, Elijah, who's featured in the film, whose family was in the gang, and the sports program really is helping him, anchor a better path, is that this film is really about not seeing deficit, but that through love and through support and through something as simple as a boxing program, that it's really a life raft that children across California need. Coaches like Daisy that are well-trained, using sports to bring hope and inspiration and a clear pathway for young people is what this film and quite frankly, what our work is about.
Thank you. So a couple of things. One, our safe spaces, a curriculum that is on our website is free, accessible to everyone. If they want to learn more about ACEs, especially in the education system. So that's meant for coaches. So if you're a coach in sports at school, please, it's available and it's accessible. Two questions for you, though. Where can folks see the documentary? Because I think it really is a wonderful opportunity for many to look at. And I understand it is being considered for some awards.
Well, it's being featured in March at the Latino Houston Film Festival. We haven't found a distribution partner, so stay tuned. They can, you folks that are listening can follow us on our Instagram webpage at LA84, my personal Instagram at Renata Angelina. We're going to keep people updated when the film will be widely distributed. If there are folks, on this call who want to schedule a screening, we're happy to have that film travel. Daisy, the producers, the directors, to engage in conversation. And so I'd say just follow us on, our Instagram or on our website, and we'll stay tuned of when we'll drop that. One other thing I want to say about research is definitely our website, LA84.org, or the playequityfund.org. We also are really involved in research, so educating, and we just last year completed a statewide play equity report that is rich with data, over indexes to the Central Valley and northern parts of the state, which don't often get looked at in terms of what are the equity gaps, where kids playing, what are their thoughts and issues around that, and so folks can access that report on our website.
Thank you, Renata. And just to remind folks, the information on Renata's organization, as well as WIC, as well as the lifestyle medicine, is going to be on our website. So you can get more information there. And I'll just ask, because I know some folks may want to know, are there any grants that are available through the foundation that folks can go and check out?
There are. Just check out our grant portal on LA84.org.
Perfect. Thank you so much, Renata, for enlightening us on LA84 and how sports movement is so critical for our kids, not only to help them physically, but beyond just physical. So now we're going to move to our last speaker. And it gives me great pleasure to introduce Dr. Brenda Rea. She serves as the Medical Director of Education for the American College of Lifestyle Medicine. She's passionate about training health professionals to use nutrition and lifestyle medicine to treat and reverse chronic disease, and strives to model these principles personally. So full bios for everyone are on our website. So Dr. Rea, thank you so much. And the floor is yours. Take it away.
Oh, thank you so much, Dr. Ramos. It's a pleasure to be here with you guys. I just want to speak just for a moment to Fariha, and her presentation was so fantastic. Back in the day, I actually, when I was completing my registered dietitian requirements, I worked for WIC for a summer. So it brought back really great memories. You guys are doing great work. And then for Renata, so wonderful. I'm a Southern California native, and sports and physical activity is such a big part of my growing up years. So it's just wonderful to hear all the work that's being done. And believe it or not, I actually got to attend the '84 Olympics in LA and got to see Mary Lou Retton. So very fun. All right, so we can go to the next slide. What I would like to do is just present to you about the American College of Lifestyle Medicine, and three main things. One is, how can we connect with the patient? Number two, how can we assess the patient? And then how can we actually create interventions that are meaningful to them? And then I'll share with you some resources. So lifestyle medicine really is, like Dr. Ramos was saying, a way that we can actually address the underlying root causes of many of our diseases that the U.S. is suffering from. And we use these different root causes to address many components and really let the patient sort of help us decide where they'd like to start and what they'd like to do. So we actually have 6 pillars really of lifestyle medicine. You can see them indicated here. So it's really about nutrition, really thinking about whole food, plant predominant nutrition, physical activity, social connections, restorative sleep, stress management, and avoidance of risky substances. And so you can see many of these pillars have already been addressed by WIC and by LA84. Next slide. So just a little bit about the American College of Lifestyle Medicine. So American College of Lifestyle Medicine really is a member society for lifestyle medicine, and it is available for all healthcare professionals, not just physicians. And so we really look for the whole team to be educated and to sort of have the rising tide for everyone. We raise all ships together and support the patients. And so we have education, certification, a practice advancement, so people can be learning how to do this in their practice, curricular and academic resources, research and advocacy, and events and networking. We're doing quite a bit of work on the Capitol Hill now with Make America Healthy Again initiatives with the new administration. So we're really excited about some of our opportunities. Next slide. All right, so the very first message I want to give you guys when you're thinking about working with patients, regardless of what your background is how do you relate to the patient? How do you connect with them? And again, I would say WIC and LA84 have got this, it sounds like, down pretty well. They're using the nutrition opportunities and the physical activity opportunities to really connect with the patient, understand their story, include the ACEs and all these other components that are influencing their choices and their options, and really listening to them and helping them make some wise decisions. And so this is critical. When we think about the patient, we really want to think about how can we find ways to encourage them and provide hope that there are other ways of doing things, and have them be valued and have them feel heard. Really connecting the patient to their own personal why of why these things matter and what they want those changes to look like. So again, the patient story and the relationship is crucial, is the most important thing. If you can connect with them to begin with, then all the other possibilities, this unconditional love and acceptance that they can feel from you, opens the space for them to decide how they want to make those changes, and you can figure out how to support them. So next slide. All right, the second component I wanted to talk to you guys about is about assessment. So I'm going to talk about formal assessment and informal assessment. So the American College of Lifestyle Medicine has created a formal assessment. It's called a short form. I'm just going to show you the physical activity and nutrition sections, but it really covers all the 6 pillars, as well as motivation and confidence and some of these other kinds of things. You can see here this physical activity assessment really is the exercise vital signs. It's a validated tool, and you can see that it really looks at aerobic activity and then strength training, how many times a week that they do this, and it really helps you compare according to the recommendations from the physical activity guidelines for Americans, that recommending 150 minutes a week. For kids, it's 60 minutes, moderate to vigorous a day. So you can kind of compare these types of things when you assess them. The one thing I do want to say about formal assessment is that we are using this tool, and we're actually working with Epic for those who are in a clinical environment to operationalize this and make this available across the United States for anybody who's using Epic, so we can start to collect this data in a standardized format, and we can start to connect it with outcomes and see how we're doing. And so I would encourage you that if you don't have a way to formally assess in a clinical environment, to actually implement something that is standardized. I recommend you take a look at these and see what you think. There's a QR code for you to access it. It's free to access, free to utilize, and we can keep you up to date about when this will actually be available in Epic. Next slide, we'll talk about the nutrition, and it's just to give you a snapshot. There's actually 9 food frequency type questions for nutrition. This is what it looks like. It's looking at your nutrition patterns over the last 4 weeks. And this is an example of the fruit question, but you can see on the right-hand side, we assess all 9 of these categories to see how a person is doing. And again, this is something that can be longitudinal over time, where you can assess them repeatedly and to see how changes have been happening over time. Again, the QR code is available for you. Next slide. If you don't have the ability to do this formal assessment, I encourage you to think about an informal assessment. And this is every time you see your patient or interact with them, you can ask them a variety of types of questions like this. What I do as a physician is I actually, when I'm looking at all their vitals for the visit, I look at their weight and their BMI and all of these different types of things. And I'll ask them something like, I'm giving you examples, open-ended questions. How are things going with your movement or physical activity, or how are things going with your nutrition or weight? And the other way you can ask it is, how do you feel about your nutrition or weight, or how do you feel about your current movement or physical activity? So this gives them an opportunity in a non-threatening way to just ask them an open-ended question. And depending on what their response is, what's really, really easy to do is say, okay, if you want to make changes, or you're worried or you're concerned, you can follow up with this last bullet point. You can say, what is one thing you would like to do differently in order to be more active or to eat more healthfully? And that enables them to start coming up with their own goal of what they'd like to do. And then you can help them operationalize that into a SMART goal or something that's measurable. And you can say, hey, can I put this in the chart so that the next time I see you, we can talk about it and ask you how you're doing? And so it's, again, asking permission, asking how you can support them, asking how they're doing, enables that open space for them to be able to share. So I encourage you to think about informal if you don't have a formal assessment. Good, next slide. And then the third component here is, how do you offer lifestyle interventions based on your assessments? And so I've divided these into physical activity and nutrition. So you can see it follows similar pattern. First, discuss the importance with them. Then prescribe, so you can prescribe physical activity or a whole food plant predominant eating pattern. We know that so many of Americans are not meeting the recommendations for plant-based eating. This is something that we can all agree on, that more plants, the better, and the healthier the person is going to be across all the age spectrums. And so really focusing on the things that we can all agree on, focusing on the positive aspects of nutrition and eating patterns is going to be really important. And then the last one here is setting SMART goals with the patient, helping them think about what they want to do between now and the next time you work with them. Next slide. What I've done here, the next few slides, really just show some resources that you can use for your patients and participants in supporting them with the discussion and thinking about any goals that they might want to set. So I encourage you to hop on and to think about what's available. I'll show you the QR code at the end of how you can access these. These are free resources. You would just sign up for a free ACLM account, and you get access to not only these handouts, but many, many handouts that are available for all of the 6 pillars. And that will be really helpful for you to use these in clinical environment. So the next one is the nutrition pillar slide. And you can just see there, it's really focusing on really eat plenty of, and the things that you can think about avoiding: inspiration, nutrition goals. We have lots of recipes, how to eat on a budget, lots of other resources that are also available to you, to potential nutrition goals that might be helpful. Again, thinking about, I never set eat less of or avoid goal unless I've had at least 1 or 2 positive goals for them to be thinking about what they're going to eat more of, focusing on the positives. A lot of people have some trauma around nutrition and food, so thinking about the positives is really important. Good, next slide. And these are examples of handouts that are also free and available. If you want to prescribe, again, you see on the left a prescription pad that you can use to help write out goals for them in any one of the pillars, and you can sign your name. So it actually is like a prescription, you're prescribing something for them. There's also this handout on the right where they can start to set healthy goals. You can print this out for them. You can work with them to create goals in these different areas. And so these are just clinical tools that are readily available for you that can be helpful. Next slide. Okay, so this brings us close to the end here. What I wanted to do is the QR code on the left really is for all of the patient handouts, for all of the tools and resources that are free available. There are also some additional resources about how to implement lifestyle medicine in a clinical environment that are also free that you can look at. So the one on the left, I encourage you to think about. And then on the one on the right is really how ACLM has been providing a free 5.5-hour CME event. It's called the Essentials Bundle. It really has an introduction to lifestyle medicine, but it also has food as medicine courses in it as well. And this was a response to make this free through September to anyone who wants to sign up for it that's actively working with patients. And they can get this free CME. And this was in response to the White House Summit on Hunger and Nutrition. And so this has been available now for at least a year, year and a half, and will be available through the end of September. So for those who want to have an introduction, want to explore, this is a free CME that I would encourage you guys, anyone, to sign up for. And there's a promo code there that will allow you to sign up for it for free. So you could scan this and access it as well. Next slide. Great. If you want to stay in touch with us, please feel free. You can scan this QR code. It will take you to our website. You can also follow us on social media at the link there. And so we would just encourage you to engage. Let us know if you have questions. And like Dr. Ramos said, I think we're going to be available on your on her website, so you can reach us through that mechanism as well. Thank you so much for your time. It's been a pleasure being with you.
Thank you so much for all of that amazing and very insightful information. Thank you, Dr. Rea. I want to open it up to questions. If I saw that there had been one question that had been asked, and I'll read it. Renata, it was asked during your time, how does the program help optimize patients' fitness health? The comment was also, I just don't think awareness is enough. What's happening to move the needle, and how is that measured? So I don't know that.
Yeah, that's a great question.
Additional.
Yeah, I think that's a great question. And I think, that's some of the conversations we're having with the Governor's Council on Physical Fitness and Mental Well-Being. You'll recall that in the middle school ages, 5th, 7th, and 9th, there was the fitness gram test that was put on hold. And that we've been having conversations of bringing the fitness gram test back so that we can actually measure the impact of sport, play, and movement. And I think part of the challenge is on awareness. And we were an organization that talked about youth sports, and we've expanded because, to Dr. Ramos's point earlier, dancing in your living room when you're elevating the heart rate, taking a walk, it doesn't have to be sort of rigorous activity all the time, but just starting small with movement. So I think efforts to bring back the fitness gram for the school-based sports that we've done is some things that we're looking at to be able to better measure the health outcomes of young kids, particularly in the school setting.
Thank you. Any other questions? And just know that there's going to be a lot of information and links to the organizations on our website. So those resources will be available.
Before we take it away, we did get one more question in the Q&A while you were answering the prior question. And this one is for our group over at WIC. And does WIC provide any macro guidance?
Can you restate that?
Yeah, definitely. Does WIC provide any macro guidance?
Macro guidance in terms of guidance that is general to populations?
I think what they're asking is macronutrients in your dietary guide.
You know, you probably will want to have an RD specifically speak to our food packages, but you can look up what we do provide and prescribe on our website. So that is myfamily.wic.ca.gov.
Thank you so much. I do not see any other questions at this time. So I will just give a big thank you to Dr. Ramos and all of our speakers, as well as all of you for attending today. We really appreciate you being part of this webinar with us. I am going to take a few minutes to close this out and provide a couple reminders. So a big piece, our preconception medical assessment, also known as PRIMA, is now available. It's available at our website, osg.ca.gov/PRIMA. Or you can go ahead and grab your phone now and scan the QR code. It'll take you directly to the PRIMA quiz. This is 8 simple questions intended to be community-based, and great news, it's now available in Spanish and will be on the website by the end of the day. Additionally, there is a toolkit available that all of you could use that we ask that you utilize our partner toolkit to share PRIMA on your social media, through your newsletters, on your webpage, really help to get this information out to anyone and everyone who may be thinking about having a baby. So again, PRIMA is available live on our webpage. Also, please share out with your groups and networks as well. Next slide. Additionally, we just launched a very new audio series, Office Hours, with Dr. Diana Ramos.
Step into Office Hours with California's Doctor, where health meets real talk. Hosted by the California Surgeon General, these conversations will tackle health issues that truly impact everyday life, from mental health struggles to game-changing medical innovations in public health. We will dive deep into the topics that matter most to Californians and their community. Informative, empowering, and thought-provoking. Whether a health professional, advocate, or simply curious about improving well-being, these conversations are a trusted source for insight and guidance. Your health is the foundation for a healthier future. Let's build it together.
So as I mentioned, this did just launch. Our first audio series is available now. Dr. Ramos is speaking with Dr. Hamid about heart health and cardiovascular and maternal health. We have more topics to come and we're really excited. Please go ahead and click on that QR code, watch this first audio session, and then more to come. Next slide, please. We're also looking for a new individual to join our team here at the Office of the California Surgeon General. The applications are due March 19th, but please do not wait until March 19th to apply. Go ahead and take a look at that now. Again, you can scan this QR code. It'll take you directly to the position. It is an office technician position. It is for administrative support to help us in the office and help support all of the activities and initiatives that we currently have in our office. Next slide. Just a reminder, if you have not already done so, please officially partner with us. When you scan this QR code, it's going to take you to a partnership form to fill out. We ask you to do this so that you will be on our email list for new updates as they come out. Whenever we have a new initiative, something like PRIMA launches, you'll have access to that information through email. And then lastly, on our final slide, and to close out just in time, please follow us on social media. We are very actively putting out new posts about things in real time and as they're happening. And we would love to hear from all of you and to be able to spotlight organizations and entities on our social media as well. So please follow us and reach out to us. In particular, our LinkedIn is a newer account, so please join us there as well. And thank you so much for joining us. We're really glad to have you. And if there's anything you could do, you can always reach out to us at Strong Start and Beyond at osg.ca.gov. Thank you, everyone.